You can go ahead and sit. Okay, the first thing that we're always going to do no matter what is wash our hands. We're going to do this before you even set up your room, okay, remember? And then when the patient comes in, generally what I'm doing is I'm going to seat them, go over health history, and then go wash my hands in front of them. After we dry, we turn off the water with the paper towel. And then we're going to come start our patient. So with COVID protocol, we will be in N95 masks, clinical masks on top of it, and then our glasses and then face shields over it. Okay, only when we're working on each other. When you guys are working on the models, the typodons, you just have to be in your regular attire. Like I said before, I would recommend putting a clinical mask on because if the prophy paste and stuff splatters up, then you can just change it afterwards. So our patient napkin, shiny side down, or you'll have water going all over the place. Like so. Then we're always going to tell our patient, we're going to go ahead and lean you back and explain to them what we're going to do. We're going to do a coronal polish today. Any questions? We already went over their medical history. We're going to go ahead and turn the light on. The way we turn the light on is you put it towards their chest. Once it comes on, then you bring it up to their mouth. If you try to aim it towards their mouth, you're going to hit them in the eyes. Normally we'd have some glasses for the patient too. I usually have you guys just put them over the top so you get used to giving the patient glasses even though they don't have eyes. So now what we're going to do, first thing is we're just going to look around the mouth. We're going to grab the mirror and Explorer. Mirror is going to go in your left dominant hand, Explorer on the right. If you guys didn't see how I set the tray up beforehand, it's going to be what we're going to use first. All of our hygiene utensils, our floss, our cotton rolls, gauze, prophy paste, extra cotton roll or cotton pliers. We're gonna set to the side of the tray. This is if we have to grab something because we don't want to use our hands, okay? So we can open the door with our hands where the covers are, reach into the drawer with clean cotton pliers so we don't have to re-glove, okay? So those are always gonna stay away. So we're gonna go ahead and go into the mouth, look around, make sure that there's no dentures, partials, crown, bridges, whatever the restorative is. If it's a new patient and we haven't charted before, we're going to go ahead, open up Ascend and go ahead and chart their patient. What you guys are going to do is when you see a patient, you're going to go in and chart existing on your patient, whatever's in the mouth. So you'll get used to looking at those restorations in the mouth and charting them. Okay, we're going to be taking pictures so that I can relay and see if you did it right or not. So fulcrums, remember what we learned today in lecture? So you're always going to have a fulcrum somewhere when you're holding on to stuff so that it keeps it nice and smooth, okay? Whether the fulcrum's in the mouth or outside of the mouth, okay? Go around, check the teeth. Once we've checked the teeth, we can go ahead and give them a disclosing tablet. With the disclosing tablet, you're going to open it up, put it in their mouth. They're going to chomp, chomp, chomp. Then they're going to take their tongue and roll it all the way around all the surfaces of their teeth. When they're done, you're going to go ahead and suction first. You don't want them to swallow this. It won't hurt them, but it could give them a little bit of an upset stomach because there's a lot of dye in it. So you're going to just suction. Then you're gonna take your air water syringe and you're going to very carefully just use water, don't use the spray, and spray around so that it all gets out of their mouth, okay? If you spray, it'll spray that dye everywhere and you'll get covered in red dye. Once they get done and you've sprayed around, you can also just throw some in their mouth, have them swish, and then go ahead and suction, okay? Then, once that is done, you can go ahead and peek around and see where all the areas are that they are missing. And if there's a bunch of areas, you can go ahead and hand them a patient mirror, go around and show them, okay, this is the area that you're missing. Really common areas are going to be the lingual surfaces of the molars, also the corners, the canines or cuspids, because people run their brush back and then they run them forward and they forget that it angles around, okay? Once you're done with that, we're gonna go ahead and get ready to polish. We're gonna take our Prophy cup and it just pops right onto the handpiece. Other ones might click on, lock on. I'll show you different ones once you get them on there. We have our rheostat down below. That's gonna make it spin. Okay, I told you guys that it takes a little bit to get used to the speed. Use your toe. Do not have your whole foot on the rheostat, because if you put your whole foot, it's really hard to keep it one speed. Using your toe, you can kind of alter it a little bit, okay? Then you're gonna position the patient. The chair moves, so don't be afraid to unlock and move it around so that you can get the patient in the correct position to where you wanna be. Also, there's plenty of room to get behind the patient and whatnot to spin. So don't be afraid to move them. Prophy paste. What I like to do is when I open up the Prophy paste, I like to take my cup and soften it up. Okay, it gets kind of chunky from just coming from the factory. So this just kind of makes it soft. Now, you saw in the video that we watched, she just uses the Prophy cup in her hand and then puts it back on the tray. We have rings that you can wear and it puts it on your finger like this, and you can use it like that. What I like to do is I like to just take a little bit with my cotton roll, my cotton pliers. Why do I keep calling it a cotton roll today? And I just put it on the back of my hand. So any way you want to do it, I don't care. It doesn't take a lot. I always have my mirror in my hand. And then you're gonna go ahead and go in. I'm gonna do the whole mouth. I'm gonna start just with the front so you guys can see. What you're gonna do, I'll pull the cheeks back so you can kind of see what I'm doing. Of course you can't do this on a normal patient. What you're gonna do is you're gonna go, and I grabbed one without gums. You're gonna go down and go underneath the gums, come up, and then kind of zigzag back, okay? So you can take it and you can spread the Prophy paste across multiple teeth. I usually do sextants, so 3, 1, 1, 1, and then lingual 2. Okay, so then you're just gonna go, I have my fulcrum, and you're going to go interproximal, go down around, come up interproximal, and then go back. Go down, around, and then come back. You don't spend a lot of time on each tooth. Once you need to reposition, do it. If I were to stay in the same position, my wrists would be all weird, okay? Move so that your wrist can stay straight. Go around, interproximal. If you need to, you can grab the section. Go ahead and section for them. Again, usually I don't rinse in between. If they need a rinse, I'm more than happy to rinse for them. And then we're just gonna keep going all the way around the mouth.
So your cup, do you fill it this part way or all the way?
I fill it all the way, but then I spread it out for the whole sextant.
And then you just use that 1 cup's worth on that sextant.
Yep. So I spread it out so it's covering all the teeth. And then you just go along. retract the tissue so that you can see. Once we get around the whole buckle, I might suction again.
Is it pretty difficult to see the sides of the nose?
Not really, especially if you have your mirror and I'll put the cheeks back so you can see again. If the cheeks are there, I'm just pulling out and I can see the same thing what you can see. Okay?
You just use your mirror to do that.
Yep. Lingual wise, remember you're gonna have a tongue, so you're gonna have to retract the tongue. And then, so pretend that there's a tongue there, you come in, fulcrum again, and then we're just gonna go same thing on the lingual.
I never know where to put my tongue.
I know it's so awkward. Just don't lick the assistant. I don't like tongues in general because I think they're just disgusting. And I had a patient that every time you just like sit there and lick your finger. It's like so, and he didn't even know he was doing it. It's just a weird involuntary action he was doing. Ugh. Okay, so we're gonna go all the way around. I'm just gonna hurry him through. Okay, once we get done, then I'm gonna go ahead and section again. Again, if they need a rinse, you can go ahead and rinse. And then we're gonna go to the maxillary. Go ahead and
Could you do rinse like one once you've done the bottom?
you can, I don't. For the reason that I'm gonna go back and floss. And if you rinse, then you're gonna have to place a little bit more prophy paste in there to get it in approximately. Right now, it's just sitting in approximately. So you don't have to add any more.
So do you want to make sure there's always paste in your cup?
Yeah, you want to make sure
doing
that
it?
there's paste on every tooth. But you can see I'm not using a lot at all. And then inside, I might have to use my mirror to do some indirect viewing. You want to always make sure that you're sitting straight up. So I don't want to see you guys going like this, even though it's way easier for direct vision. You can also just adjust the chair. This Dexter model is doing a pretty good job of just opening really wide. Of course, with a patient, for the maxillary, we'd want to put him up and then lay him back a little bit more. Okay, and then once we get done with this, then what I'm gonna do, maybe suction. You kind of forget to suction when they don't have saliva going on. Then I'm gonna go ahead and switch to my brush. Just gonna pop this guy on, and then I'm gonna do the occlusal surfaces. Not everybody's gonna need the brush for the occlusal surface. If they don't have any staining or anything on the occlusal surface, you can just use the prophy cup. Okay, if they have really deep fissures and grooves, you can go ahead and switch to the brush. And then you're just going to do just the occlusal surface, remember. And that's just a brush that gets in all those little areas. Never go down to the gingiva.
So this is just for
This is just going back to the
the
occlusal.
exterior.
Yep. Sometimes the anterior will have some lingual grooves that you can get in. You just have to be really careful not to get down by the gums. Okay, and then when that's done, I'm gonna go ahead and suction again. And then we're gonna floss. So when we floss, you want about 18 inches of floss. You're gonna wrap it around your middle finger. Go ahead and take off the extra prophy paste so it doesn't plop into their eye. And then when you floss, I'm gonna do it up here, you're gonna create a C. So you're gonna shimmy down the contact, and then you're gonna wrap around the tooth like a C and go down until it stops. And then you're gonna come up the tooth and pull out any of that extra gunk that's in there. Then you're gonna go down the other side and see and bring it up. Okay, see, and then you can go over and across, see, come up. You're not gonna pop down and then go back and forth. Okay, that's just trauma to the embrasure area. So gently guide through, see, see, and then come up. And you're gonna do this around the whole mouth and behind the last tooth. A lot of people forget to do behind the posterior teeth because there's no contact, but there still gets a lot of buildup back there. Okay? Once that's done, now we're gonna rinse. So when I do this rinse, I'm gonna put the lips back. You can use the saliva ejector or you can use the HVE. I want you guys to practice with both, okay? The HVE is a little bit trickier. You're gonna hold it like a palm thumb grasp. You're gonna take the section and you're just gonna go, like she said in the video, you're just going to pull back and hold it in the posterior region, okay? Gravity will pull it back there. And then you're just going to start with water, just water alone. I usually do maxillary on one side, mandibular on one side. After I rinse that, then I can do a little bit of a flush. So I'm going to actually use air and water. And this will get everything out of there. Once that side's done, again, I'm not going straight to the back of their mouth and sucking up their uvula, okay? You're just going to pull the cheeks back and gravity will just let the water fall right into your section. Then we can turn it and come over to this side and do the same thing. Water first. Using the section as a tissue retractor, and then air and water. Pull it back and let the water just flow out. Okay, you're gonna suck up cheeks. Okay, when you do it, just pull it off. It doesn't hurt them. You might. I'm not gonna say it's never happened. And then after that is done, then we're gonna take our second disclosing tablet. We're gonna put it in their mouth, chew, 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 do the exact same thing, suction, rinse, and then we're gonna look to see if we missed any areas. Okay? If we missed any areas, we can go ahead and switch back to the Prophy cup, go back in and adjust and go over those areas again. All right? Questions, you can go ahead and turn it off. Thank you.